Unlocking the power of CPT code is the key to streamlining medical coding and ensuring proper reimbursement. Join us as we explore the importance of this knowledge. Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCoding site. Hi, I am Nishaba, a certified medical coder. In this video, we will explore the procedure codes of lower abdomen, the next anatomical site of CPT anesthesia. Let's embark on our journey of exploring codes. Lower abdomen, the next anatomical site of the CPT anesthesia. Lower abdomen is the portion that falls under belly button. First code is 00800. Anesthesia for procedures on lower anterior abdominal wall not otherwise specified. It means the provider performs anesthesia service for a patient undergo a procedure on the lower anterior abdominal wall. This code is used for the procedure not specified by other anesthesia code. Next code is 00802 paniculectomy. Panniculus is an apron of excess skin and fat hanging from the abdomen below the waistline. Ectomy means removal. The provider performs anesthesia service for a patient undergoing the procedure in which the surgical provider excises excess fat and skin called a pannus via an incision below the navel. Next code is 00811. Anesthesia for lower intestinal endoscopic procedure. Endoscope introduced distal to duodenum, not otherwise specified. The provider performs anesthesia services for a patient undergoing an unspecified lower intestinal endoscopic procedure where the surgical provider introduces an endoscope into the intestine up to, but not into the duodenum, the part of the intestine just below the stomach. Next code is 00812 screening colonoscopy. Screenings are medical tests that doctors use to check for disease and health condition before there are any signs or symptoms. The provider performs anesthesia services for the patient undergoing a procedure during which the surgical provider introduces an endoscope into the intestine below the duodenum, the part of the intestine just below the stomach. Next code is 00813 anesthesia for combined upper and lower gastrointestinal endoscopic procedures. Endoscope introduced both proximal to and distal to the duodenum. The anesthesia provider performs anesthesia services for a patient undergoing both upper and lower gastrointestinal endoscopy, where the surgical provider introduces an endoscope into the intestine above and below the duodenum, the part of the intestine just next to the stomach. Next code is 00820. Anesthesia for procedure on lower posterior abdominal wall. Next code is 00830. Anesthesia for hernia repairs in the lower abdomen not otherwise specified. Next code is 00832 ventral and incisional hernias. Next code is 00834 anesthesia for hernia repairs in the lower abdomen not otherwise specified younger than 1 year. Next code is 00836 anesthesia for hernia repairs in the lower abdomen not otherwise specified. Infants younger than 37 weeks gestational age at birth and younger than 50 weeks gestational age at time of surgery. Gestation is the period of time between conception and birth. Next code is 00840. Anesthesia for intraperitoneal procedure in lower abdomen including laparoscopy not otherwise specified. Next code is 00842 aminocentesis. The provider performs anesthesia services for a patient undergoing a procedure in which another provider extracts fluid from the uterus of a pregnant female using a needle. Next code is 00844 abdominoperineal resection. It means the anesthesia service is provided for a patient undergoing a procedure in which the surgical provider removes large tumors laying very low down in the rectum along with the anus, the external opening of the intestine. Next code is 00846 radical hysterectomy. The provider performs anesthesia services for a patient undergoing a procedure in which the surgical provider removes the uterus along with the surrounding structures. Next code is 00848 pelvic exenteration. A pelvic exenteration means removal of reproductive organs, the bladder or rectum or both, and lymph node in the pelvis. Next code is 00851 tubal ligation or transection. Tubal ligation is a surgical procedure for female sterilization which involves severing and tying the fallopian tubes. The word transection is a surgical procedure where a transverse cut or division is made. The provider performs anesthesia services for an intraperitoneal procedure in the lower abdomen, including laparoscopy and tubal ligation or transection. Next code is 00860. Anesthesia for extraperitoneal procedure in lower abdomen, including urinary tract, not otherwise specified. Extraperitoneal structure lies outside the peritoneal cavity. The extraperitoneal organs include the suprarenal glands, aorta, inferior vena cava, second and fourth part of the duodenum, pancreas, acceptals, ureter, kidneys, colon, ascending and descending, esophagus, rectum, and bladder. The provider performs anesthesia service for an extraperitoneal procedure in the lower abdomen, including the urinary tract. Next code is 00862. Renal procedures, including upper one-third of ureter or donor nephrectomy. Next code is 00864. Total cystectomy. Cyst means bladder. Ectomy means removal. Next code is 00865. Radical prostatectomy, suprapubic or retropubic. In the suprapubic approach, the front wall of the bladder is opened and we remove the enlarged center of the prostate through this opening in the bladder. In the retropubic prostatectomy, the prostate is removed through an incision in the wall of the abdomen. The provider performs anesthesia services for a patient undergoing removal of prostate and some of the surrounding tissues. Next code is 00866 adrenal ectomy. The provider performs services for a patient undergoing removal of one or both adrenal glands. Next code is 00868 renal transplant recipient. Next code is 00870 cystolithotomy. Cyst means bladder, litho means stones, otomy means cutting. It means the provider performs anesthesia service for a patient undergoing removal of stone from a bladder via cutting. Next code is 00872. Anesthesia for lithotripsy, extracorporeal shock wave with water bath. Litho means stones, tripsy means crushing. The provider performs anesthesia services for a patient partially submerged in liquid while undergoing treatment of kidney stones or uterus stones by extracorporeal shock waves. Next code is 00873. It is without water bath. Next code is 00880. Anesthesia for procedure on major lower abdominal vessels not otherwise specified. Next code is 00882, inferior vena cava ligation. It means the provider perform anesthesia services for a procedure on major lower abdominal vessels, including inferior vena cava ligation. If you have any question or need further clarification, feel free to ask in the comment section or reach out via email. Thank you for watching. If you enjoyed the video, please like, share it. Your support means a lot to me. If you haven't already, consider subscribing for more. Click the bell icon to receive notifications. For more detailed guidelines, CPC mock or exam related questions and notes, email me at my given email ID.